So what are going to be some of the basic equipment that you need? So to understand the ultrasound and, answer questions on the boards and do well in the hospital, there are three things that kind of all need to interact together. Number one, you got to be a good operator. And how do you become a better operator? It's just like practice. When we talk about ECGs, the more you read, the better you are. Chest x-rays, the more you interpret, the better you are. Same thing when we talk about the ultrasound machine. It's the more practice that you get. But with being a good operator, you got to understand the keyboard. And that's why we're doing this knobology talk right now, to understand what are you doing to get the best picture. And then, of course, it's the probe, right? And we all learned, don't drop the probe. That's not good. But how are you going to manipulate the probe? You know what I mean? And we're going to go over some basic techniques, whether we're talking about heart and lung, to kind of get the best image possible. So all three are important when we talk about trying to be a good ultrasound person to get the images you want at the right time. So what is knobology? Well, I swear I thought this word was made up, but I went to look it up on Google, and so many people have done presentations on knobology, and it is what it sounds like, is looking at the different knobs on different devices. I put a picture here of the ultrasound machine that I use most commonly. But like I said earlier, you definitely want to be familiar in a practical sense with the ultrasound that you have in your office or in your ICU. So let's focus on these knobs. What are the purpose of them? I kind of broke it down to the three main things that we want to do. The first thing is going to be to fix the image. So we're going to talk about the exam settings, the depth, and the gain. We want to detect motion. We'll talk about something called the M mode. And sometimes you want to do some measurements. I'm going to tell you on the critical care boards are not going to make you measure anything. This is something that's a little advanced, but if you do want to make some measurements, we use some of the buttons such as the calipers. You want to freeze, you want to save an image, you may want to do calculations. But on board exams, you're really going to be focusing more on interpretation of the image itself. And the one part of knobology I think is very important is how do you fix the image and when do you use M mode?